Hey everyone, welcome to KSSP Podcast. I am Spencer.
And I'm Katie. Today we are going to be going over some basic female anatomy. I've got a few articles pulled up that we're going to take a look at today. So let's see. Female anatomy includes the external genitals, or the vulva, and the internal reproductive organs, which include the ovaries and the uterus. So there's external anatomy. There's the mons pubis, or I think this is a typo. I think that's supposed to say pubic mound, but it says public mound. Okay. It's a fleshy area on the pelvic bone where females typically grow hair. All right. The vulva, the external part of the female's genitals. And there's labia majora, the outer lips, and then the labia minora, the inner lips. We have the clitoris. It is at the top of the vulva, located where the inner lips meet. It's usually the size of a pea. Only the tip is visible, but there's two shafts that extend into the body by as much as 5 inches. And it contains many nerve endings that are very sensitive, especially during stimulation. Then there's the clitoral hood, the fold of skin that surrounds the head of the clitoris, and the urethral opening, and sits above the vaginal opening and connects to the bladder. And this is where you pee out of, basically. So there's a separate hole that you pee out of, just to clarify. So a lot of people don't know that. And then there's the internal anatomy. The cervix separates the vagina from the uterus, and the fallopian tube connects the ovaries with the uterus. The vagina is the canal that connects the vulva with the uterus. The opening to the vagina is part of the vulva. It can vary in size. The average length is about 2.5 to 3 inches, but the length can expand during arousal. It also contains special structures called Bartholin's glands. These are 2 pea-sized glands that sit on either side of the opening. These glands are responsible for secreting lubrication to keep the vaginal tissues from becoming too dry. And there's the cervix. It's the lower portion of the uterus, cylinder-shaped area of tissue, separates the vagina from the rest of the uterus, and during birth, the cervix dilates to allow the baby to move through the vagina. And then there's the uterus. It's located in the middle of the pelvic cavity. And then this is where the fetus is held during pregnancy. It is a muscular sac. During the menstrual cycle, the lining of the uterus thickens with blood in preparation for the release of an egg from one of the ovaries. This is to prepare a nourishing environment for a fetus if a pregnancy occurs. If pregnancy does not occur, the uterine lining sheds. This is called the menstrual period. It occurs every 28 days or so, though the cycle length varies between females. And the upper portion of the uterus is connected to the ovaries by the fallopian tubes. Let's see. And the ovaries, they're egg-shaped organs attached to the fallopian tubes on the left and right sides of the body. Each ovary is roughly the size of an almond. Most females are born with 2 that produce eggs. In addition to producing eggs, they also produce hormones, mostly estrogen and progesterone. And then the fallopian tubes connect the ovaries to the uterus. When the ovaries release an egg, the egg travels down the fallopian tube towards the uterus for potential fertilization. If a fertilized egg implants in the fallopian tube, this is an ectopic pregnancy, and this is a medical emergency because the fallopian tube can rupture. And the hymen, it's a membrane of tissue that covers the external vaginal opening. Not all females have one, however. It can rupture as a result of pelvic injury, sports activity, pelvic examination, sexual intercourse, or childhood, or tampons. They don't have that listed on here, but tampons as well. The absence of a hymen does not mean that a female has been sexually active. True. Then there's breasts. So you've got the nipple, areola, and breast tissue. And then the internal anatomy of the breast, the alveoli, the milk-secreting cells, grouped into clusters. Lactiferious ducts, special channels that open on the nipple surface. Breast milk exits through these ducts to nourish a baby. Lobules. These are collections of alveoli in the breast that secrete milk. And the lobules drain into lactiferious ducts, then into lactiferious sinuses that promote milk to flow from the nipple. And then the mammary glands, responsible for producing breast milk. Oh, I thought they were going to have a diagram on here.
I was going to ask, did your other one have a diagram?
Yeah, but I couldn't.
Oh, okay. I mean, you could try clicking it again, or Google like an educational. I know you're going to be talking about menstruation, correct?
Yes.
So I have a question that I feel like I
Yeah.
don't think we covered in nursing school, but do you know why? Like, I understand like what you said, so I understand I understand how it happens, like why there's so much blood, because it is to prepare for the baby, but why? Like, does the blood offer nutrition? Like, I guess I don't think we learned that in nursing school. I don't remember, but does the blood, or is it just supposed to be like a cushion of, but because it said that the uterus will become thick with the blood lining, correct? That's what it said.
Yeah.
But like,
I'm not sure
why?
though.
Okay, maybe we can.
We can look that up.
Yeah, I don't know if
I
your
just wanted to
other.
look at this picture here quick.
Yeah, I think visuals are really nice at like being able to
So,
fully understand.
yes, the hymen is right. It would be right here towards the opening. And then this section right here is the vagina. This is where you'd interact during intercourse. And then the cervix is where that kind of cuts off and separates the vagina from the uterus. So, like, if you're having sex with someone who's pregnant, like, you're not gonna, like, hit the baby's head or whatever.
Mm.
Like, the cervix is kind of there. So,
Yeah.
I don't think that would happen. Then there's the fallopian tubes right here in the ovaries. Yeah. And then, okay. We can look up.
Especially because it's like, I mean, it can just be super dangerous too for you guys. So,
Yeah, because heavy periods can have causes that aren't due to underlying disease. Examples include regular variations among individuals, hormonal imbalance, IUD use, or medication side effects. Oh, all they have is like heavy bleeding, but that's not what I'm looking for.
well, okay, let's look at heavy. So, a balance between the hormones regulates the buildup of the lining. So, it's when the lining. So, I understand why because the lining is what the egg attaches to, correct? If I remember that from nursing school, that is. So, I understand why the lining needs to be, because I don't think an egg can attach if the lining doesn't build up, right?
Yeah, I don't think so.
Okay.
I guess you would know better than me.
Well, maybe Google it just to make sure, because I don't think it can, though. I don't think because obviously if someone is low on hormones, I think it can affect whether or not they can get pregnant, right?
Yes. So the fertilized egg must attach to the uterine lining, yeah.
But it has to be like the built up uterine lining. So I guess it's technically that those cells that build up and then they shed, which leads to the bleeding, I guess. But I still like, I don't know. Would an evolution have just made it like absorbable for you guys, you know? Like, come on, body. What are you doing? I don't know.
Yeah, we could evolve a little bit better. All right. So ovulation. All right. So this is an overview of the menstrual cycle next. Ovulation is when the mature egg or ovum is released from one of the ovaries. The ovaries are the two female reproductive organs found in the pelvis. Let's see. If the egg is fertilized by sperm as it travels down the fallopian tube, then a pregnancy occurs. The fertilized egg attaches to the lining of the uterus. The placenta then develops. The placenta transfers nutrition and oxygen to the fetus from the mother. If the egg does not become fertilized, the lining of the uterus is shed during menstruation. The average menstrual cycle lasts 28 days, although it can vary from person to person. The cycle starts with the first day of one period and ends with the first day of the next period. The average woman ovulates on day 14. At this time, some women have minor discomfort in their lower abdomen, spotting, or bleeding, while others do not have any symptoms at all. A woman is generally more likely to get pregnant if she has sex a few days before and during ovulation. Yeah, so menstruation is when the lining of the uterus is shed. This occurs throughout a woman's reproductive life. With each monthly cycle, the endometrium prepares itself to nourish the fetus. Increased levels of estrogen and progesterone help thicken its walls. And if the fertilization doesn't occur, the endometrium, along with blood and mucus from the vagina and cervix, make up the menstrual flow that leaves the body. through the vagina during the period. This number has been getting lower and lower as the years go on. Like, it used to be a little bit of an older age from what I understand. Or not, I guess it's always been around age 12, but now there are younger girls who are getting their periods at like 8 or 9. So yeah, it's typically 2 to 3 years after breasts start to grow. This is as soon as she notices body hair. And the stress, strenuous exercise, and diet can affect when a girl has her first period. And then, how long is the menstrual cycle? An average one lasts 28 days. Let's see, we read that. The length of a woman's cycle varies, particularly for the first year or two after a young woman has her period. Women may have cycles as short as 21 days or as long as 45 days during the first few years. However, anything outside of this range may require medical attention. So, yeah, for example, I can give you a personal example. So I was put on an IUD, and one of the side effects was that I had a period for about 6 months straight, and it was awful. So there's definitely different things in your life, like different outside factors, biological factors, medications, things like that, stress, diet, that can affect your period. But yeah, definitely see a doctor if it's outside of the range of 21 to 45 days. So pregnancy 101, things mom never told you. So these are things to expect during pregnancy. Let's see. So spider veins is on here. Looks like they disappear usually after the pregnancy. But if they can't, a dermatologist can make them disappear with saline injections or laser zapping. You can have an itchy belly. Because it looks like a combination of dry skin and the stretching of the skin as the baby grows. As the fetus grows. Bleeding gums and nosebleeds. Oh, wow, that's interesting. It triggered increased blood flow to the mouth and nasal passages that in turn can lead to bleeding gums and nosebleeds. Change in sex drive. Yeah, it looks like this person, I'm sure it's different between every woman. Every person who's pregnant in general. But I would assume that for some people it goes down and for some people it goes up. But this person says it went up for her. Vivid dreams and disturbing thoughts. Early lactation. Fatigue. Constipation. Yeah. And those are just some things to expect if you are carrying out a pregnancy, and also some complications of pregnancy, just so that people are aware. And this kind of emphasizes that a pregnancy is a medical event. Although the majority of pregnancies are uneventful, some complications do happen. So amniotic fluid complications. Too much or too little amniotic fluid in the sac around the fetus may be a sign of a problem with the pregnancy. Too much fluid puts too much pressure on the mother's uterus, leading to preterm labor. It can also cause pressure on the mother's diaphragm, leading to breathing difficulties. Fluids tend to build up in the case of uncontrolled diabetes, a multiple pregnancy, incompatible blood types, or birth defects. Too little fluid may be a sign of birth defects, growth retardation, or stillbirth. And bleeding. Okay, bleeding in late pregnancy may be a sign of placental complications, a vaginal or cervical infection, or preterm labor. Women who bleed in late pregnancy may be at a greater risk of losing the fetus and bleeding excessively. Bleeding at any time during the pregnancy should be reported to your healthcare provider right away. And then we have ectopic pregnancies, when the fetus develops outside of the uterus. This can happen in the fallopian tube, cervical canal, or the pelvic or belly. The cause of an ectopic pregnancy is usually scar tissue in the fallopian tube from the infection or disease. The risk of ectopic pregnancy is increased in women who have had tubal sterilization procedures, especially women who are younger than 30 at the time of sterilization. Interesting. Ectopic pregnancies happen in around 1 out of every 50 pregnancies and can be very dangerous to the mother. Symptoms may include spotting and cramping. The longer an ectopic pregnancy goes on, the greater the chance that a fallopian tube will rupture. An ultrasound and blood test may confirm the diagnosis. Treatment of ectopic pregnancy may include medicine or surgical removal of the fetus. Miscarriage or fetal loss. Miscarriage is a pregnancy loss that happens up to 20 weeks of gestation. Most miscarriage happens before 12 weeks. Miscarriages happen at about 15% of all pregnancies and are usually due to genetic or chromosomal abnormalities. Miscarriages are usually preceded by spotting and intense cramping. To confirm a miscarriage, an ultrasound and blood tests may be done. The fetus and contents of the uterus are often naturally expelled. If this does not happen, a procedure called a dilation and curettage. I don't know what that is, but that may be necessary. This procedure uses special instruments to remove the abnormal pregnancy. Fetal loss in the second trimester may happen if the cervix is weak and opens too early. This is called incompetent cervix. In some cases of incompetent cervix, a healthcare provider can help prevent pregnancy loss by stitching the cervix closed until delivery. Ooh, sounds kind of painful.
Yeah.
Ow. Placental complications. Under normal circumstances, the placenta attaches to the uterine wall. However, two types of placental complications may happen, including placental abruption and placenta previa. I don't know if I said that right, but
Yeah, I think placental previa.
Previa, yeah.
Yeah, pretty much.
Placental abruption. Sometimes the placenta becomes detached from the uterine wall too soon. This is called placental abruption and leads to bleeding and less oxygen and nutrients to the fetus. The detachment may be complete or partial. The cause of placental abruption is often unknown. Placental abruption happens in about 1 in every 100 live births. They happen most commonly in women who smoke, have high blood pressure, and or have a multiple pregnancy. It also happens in women who have had previous children or a history of placental abruption. Symptoms and treatment of placental abruption tend to depend on the degree of detachment. Symptoms include bleeding, cramping, and belly tenderness. Diagnosis is usually confirmed by doing a complete physical exam and an ultrasound. And women are usually put in the hospital for this condition. They may have to deliver the baby early. And then we got placenta previa. Normally, the placenta is located in the upper part of the uterus. Placenta previa is a condition in which the placenta is attached close to or covering the cervix. This type of placental complication happens in around 1 in every 200 deliveries, happens more often in women who have scarring of the uterus from previous pregnancies. It also happens in women who have fibroids or other problems in the uterus, or in women who have had previous uterine surgeries. And symptoms include vaginal bleeding that is bright red and not associated with belly tenderness or pain. Diagnosis is confirmed by doing a physical exam and an ultrasound. Depending on how bad the problem is at the stage of pregnancy, a change in activities or bed rest may be ordered. The baby usually has to be delivered by C-section to keep the placenta from detaching early and depriving the baby of oxygen during delivery. And then we've got preeclampsia or eclampsia. Preeclampsia, formerly called toxemia, is characterized by pregnancy-induced high blood pressure. It is accompanied by protein in the urine. Sometimes swelling due to fluid retention is also present. Eclampsia is the more severe of this problem. It can lead to seizures, coma, or even death. The cause is unknown, but it is more common in first pregnancies. It affects about 5 to 8% of all pregnant women. Other risk factors for preeclampsia include a woman carrying multiple fetuses, a teenage mother, a woman older than 40, a woman with high blood pressure, diabetes, and or kidney disease before she became pregnant, a woman who is obese with a BMI greater than 30. Symptoms may include severe swelling of the hands and face, high blood pressure, headache, dizziness, irritability, decreased urine output, belly pain, and blurred vision. Treatment will vary according to the severity of the condition and the stage of the pregnancy. Treatment may include hospitalization, bed rest, medicine to lower the blood pressure, and close monitoring of both the fetus and the mother. Interesting. So, yes, just so people do know, there are a lot of medical risks associated with pregnancy, just to be aware of.
Yes. And I think, obviously, I mean, I feel like that is just stuff like everything we've gone over so far is just, and everything that we'll go over. I just feel like this is stuff that should be taught in to everyone in like high school or middle school even. But yeah, I just feel like I don't expect anyone to fully remember it if they're not going to be going into a healthcare field, but I do think that you should have at least a basic understanding of it. And you know who should 100% always have a basic understanding of this is anyone who is going to be trying to legislate it.
Yeah, definitely. I agree with that 1,000%. So, okay. So we've got some different types of contraception on here. So let's see. We have, I don't know what a cap is, so I'm going to be learning that. There's the cap, combined pill, condoms, contraceptive implant, contraceptive injection, contraceptive patch, the diaphragm, female condoms, female sterilization. Okay. IUD, IUS, progesterone only pill, vaginal ring, vasectomy, and then natural family planning, fertility awareness. So let's see. The cap. So the contraceptive cap is a circular dome made of thin, soft silicone. It is inserted into the vagina before sex and covers the cervix so that the sperm cannot get into the womb. You'd need to use spermicide with it. Spermicide kills sperm. Spermicide comes as a gel, cream, foams, and pessaries. The cap must be left in place for 6 hours after sex. After that time, you take out the cap and wash it. Caps are reusable. Some brands come in different sizes. They're designed so that you can choose the best one for yourself. Yeah, that sounds like a hassle.
Yeah, and I don't. Did it say? I don't. Sorry, did you say how effective it said it was, or does it even?
Oh, it says 92 to 96% effective.
Oh, okay.
Although that's just like in a lab, like in the real world where like people forget to use it or don't put it in properly, it's 88% effective.
Oh, okay. And but that is as long as they're using the spermicide as well, right? Like, I'm assuming without the spermicide, it'd be even less effective, is what I would think.
Yes. Yeah, I don't even know if it would work without spermicide.
Yeah, probably.
Because it said it had to be used with spermicide.
Did it? Okay. Then yeah, I don't think it would be effective at all then either if you don't follow the directions.
Yeah. And there's the combined pill. Contains synthetic female hormones, estrogen and progesterone. The hormones in the pill mimic the ones made naturally in the ovaries. And the pill stops a woman's ovary from releasing the egg, and they make it difficult for sperm to reach the egg, or for an egg to implant itself into the lining of the womb. It can also be used to treat painful periods, heavy periods, premenstrual syndrome, and endometriosis. The pill is over 99% effective when taken correctly. In the real world, about 92% effective. You need to take a pill every day for 21 days, then stop for 7 days, and during this week you have a period-type bleed. You still be protected against the pregnancy during these 7 days. You start taking the pill again after 7 days. So side effects, mood swings, breast tenderness, and headaches. There's no evidence that the pill makes women gain weight. There's a very low risk of side effects, such as blood clots and cervical cancer. The combined pill is not suitable for women over 35 who smoke or women with certain medical conditions. The pill does not protect against STIs. Using a condom as well will help you protect against STIs. So the pill prevents the ovaries from releasing the egg each month, and also thickens the mucus in the neck of the womb, so it's harder for sperm to reach the egg. And it thins the lining of the womb, so there's less chance of a fertilized egg implanting into the womb and being able to grow. And then condoms.
Do you think that is their rationale on trying to ban contraception? Because of the fact that if an egg is fertilized, contraception prevents it from attaching, so then you are... I know you're not killing a child, but...
Yeah, that's the argument, yeah.
Okay, that is stupid.
Yeah. So condoms prevent against STIs, and they're also an effective method of contraception. We'll just look at the numbers here really quick. Condoms are 98% effective at preventing pregnancy, but in real-world use, they're 85% effective. And this is due to incorrect use, condoms bursting, or slipping off. And in most areas, you can get free condoms from sexual health clinics and some GP practices, pharmacies, or young people's clinics. In many areas, you'll be able to have free condoms delivered by post. Oil-based products such as moisturizer, lotion, and Vaseline can make latex and polysporine condoms less effective. Oil-based products are safe to use with condoms made from polyurethane. Water and silicone-based lubricant available at pharmacies and sexual health clinics is safe to use with all condoms. And I don't think we need to go over all of these, but I think those are like the main ones.
The main ones.
Over. Yeah.
Okay. Yeah, and I mean, they'll see.
Yeah, like, these are a list of all the options here.
Yes.
If anyone else wants to go look into them. This is nhsinform.scot is the website. And this article is the different types of contraception. So yeah, that's all I had for today.
Okay. I think that was good information. I felt a little bit like I was back in nursing school, but again, that's good. I feel like that is also just things that people should be taught in high school or middle school. I don't know when, because I don't know the appropriate time to teach it, because I don't even have kids or anything either. So, but it definitely needs to be taught. I think everyone should be, even if you don't go to college. I think it's just something that we should all be taught. And again, I don't expect people to have it memorized, because I definitely don't. But at least then when someone's talking about it again, I know for me, I would say my memorization skills aren't great, but I didn't memorize everything you said, but the minute you mentioned it again, I was like, oh yeah, that's right. So even just having a brief in high school or middle school, or even if we were to, I mean, obviously we can't force people to learn outside of, the government can't force that on people, but if everybody was sent a pamphlet or something, like a PowerPoint, I don't know, something, that way they had, I think it would, but definitely for the younger generations, at least it would be in their brains somewhere. They may not memorize it, and that's okay. But if it ever, when they're in relationships or whatever in the future, or dealing with any of this, they'll kind of have already a basic understanding and may need to pull up the information again or kind of research a little more in depth into it, but at least they will kind of have an understanding of what's going on.
Yeah, and the more you expose yourself to it, the more you'll understand it as well.
Yes, 100%. But yeah, I just think, especially though, anybody who is trying to write legislation or pass legislation needs to have an in-depth understanding of this stuff, which they don't, which we have seen that they don't. So they shouldn't even be legally allowed to write legislation on things they don't. Nobody should be legally allowed to write legislation on things you're not educated on.
Have, expert input.
Yes. That's ridiculous that we allow that.
Yeah.
But otherwise, it was very good and very informative. Yeah. So that was all though then. Okay. So you guys just leave a comment below on this video letting us know if there's anything you want us to talk about in future episodes.
Yeah, and you can also reach us on Facebook, Instagram, TikTok, and Twitter. And we do some Twitch live streams now as well.
Yes, so that you are notified, make sure you follow, and turn on notifications. That way you can join us sometime. But otherwise, we will see you guys next time.